What are the most common things that we deal with in revision rhinoplasty surgery? There are a whole number of things that we see during revisions, but there are a few things that come up on a quite frequent basis. The first is the overly narrowed bridge. This is usually the result of surgery that takes off the bridge, however does not resupport the cartilages and just breaks the bones, allowing them to collapse. We typically fix this by placing things like spreader grafts and resupporting. This will oftentimes correct functional issues associated with that nasal valve collapse as well. The other is the overly pinched or the uni-tip. So if a surgeon aggressively resects these cartilages or pinches the tips, you almost get this very sharp and pointy tip here that may be refined, however not aesthetically pleasing. The other is the over-bulbous tip. This could be the result of many different things, but frequently I find that if a tip is left too round, it's often blamed on thick tissue, but that's not always the case. Convex cartilages that are very round and also positioned in a certain way can be difficult to address, and oftentimes this is missed during primary surgery. So this is something I run into very frequently. By changing the trajectory of the cartilages, by flattening them out, we can achieve a much more refined and aesthetically pleasant nose. The other is poor tip support. So this columellar area over here is very important in supporting the tip. It's not just about the tip itself. You want good support, and very frequently I find that this area has not been supported. And again, there are a number of ways that we address this by resupporting the tip there. The other part, and this I see very frequently, are retracted nostrils. The cartilages for the tip come out over here. Sometimes this outer part, as I mentioned, the convex part here, can cause bulbosity, but it also supports the nose. So if this is treated in a very standard way and the cartilage is just cut away, sure, it will reduce the fullness in this area. However, it'll also reduce the support, and that leads the nostril to flare upward. That flared nostril can even give the appearance of a nose being dropped, because when the nostril is higher, the tip looks dropped. I frequently see patients coming in and one of their main complaints during revisions is that their tip is dropped. After doing morphing and explaining everything to them, I show them that just by dropping the nostrils themselves, now the tip looks level, and quite frequently we don't even have to rotate the tip unless the patient wants to. So those are the more common things, but you really have to sit down with the surgeon and discuss all the nuances and all the little things that you see in your nose and discuss what potentially went wrong and how you can fix those.